Okay, hello. My name is Scott Cairns, and I'm going to be giving a mini presentation on leading a tiny team. The tiny team that we're going to be talking about are a dentist, some number of dental assistants, and healthcare coordinators, or a healthcare coordinator, depending on your office. All right. First, another just, kind of my intro slide here. I'm Scott Cairns. I'm a dentist. I work with PDS Health. And the reason I do that is to enhance the lives and livelihoods of all the general dentists who choose to work with PDS Health so that they may best serve their patients and themselves. I really strongly believe that Steve has created an organization that's built on serving dentists and other providers, but primarily the general dentist, so that we can have a life that we desire. And he's kind of taken a lot of the friction out of it. So here we go. This is a presentation that has some goals, and those goals are: we want to understand in what ways a dentist is a leader, understand how leadership works in a tiny team, become familiar with the 6 leadership styles. Okay, understand what is meant by organizational climate, and become familiar with something called the climate survey. All right, so moving right along. Again, this is a mini presentation, so this is something you can hopefully watch while you're, in between patients or at home. You can listen to it while you're driving, whatever is easiest for you. All right, so there is, when it comes to leadership, what we're trying to do is get a desired outcome. And, in order to get to that outcome, we have to have something, something has to happen, something has to transpire between more than one person, and that's called communication. And I think that one of the main things that we try to communicate are standards and our expectations as the leaders. And again, the leader is the one who's kind of setting a lot of the standards and expectations up. There's also handling problems such as stress and distress within the system and within people. And then there's also the complexity of the relationships. All of that kind of melds together in a witch's brew, and you get this desired outcome, whatever that may be. All right, so what is a tiny team? Theoretically, the tiniest team would be 2 people. 2 people have a distinct advantage when it comes to handling problems and actually communication. And the reason is because there's only one connection. There's a connection of the 2 people. So that one bond, if I said it to you, I only have to say it to you. So that creates a lot of clarity, and a lot of the problems with more and more complex communication styles don't have to happen. However, in dentistry, there are very few 2 people teams where the dentist and the other person who does everything else that needs to be done. So there's almost always at least a healthcare coordinator in the mix, even if you only work with one dental assistant. And then, but the problem is when you get to a 3-person team, there are actually 6 connections. So if you think about it, there's a connection between the dentist and the dental assistant, between the dentist and the healthcare coordinator. There's a connection between the healthcare coordinator and the dental assistant, and it just kind of keeps going in different combinations. So 2 people can be having a connection without the other one. All 3 can be in a connection. So and it just gets more and more complex. So if you add in 4 people, there are 24 possible combinations of connection, and it just grows. I don't know if it's exactly exponential, but it's a huge number when you get to a 5-person team and a 6-person team and a 7-person team. The more people that are on the team, the more variations of communication style can occur between all of these people, and it can get to be overwhelming, and that's where lots of balls get dropped and lots of frustrations for the leader who hasn't figured out how to, do some of these good leadership styles, um, has some struggles. So I'm here to not tell you that I'm perfect at this. I'm not. We all have leadership strengths and weaknesses. So when it comes to leadership, we're going to move on to what are the different styles. All right, so there's 6 leadership styles that were kind of identified by Daniel Goleman. And those are visionary, coaching, affiliative, democratic, pace setting, and commanding. Now, 4 of those are the first 4 are typically considered positive. As far as helping or the climate, which we'll get into that in a minute, helping everyone feel connected and feel good about their workplace. The other 2 are also, necessary, but they can be have some negative tendencies. So we're going to talk about what those styles are. However, I want to be clear that in Daniel Goleman's work, he often referred to this as like a bag of golf clubs. So there is no perfect style. There's nothing that you can only play one, play 18 holes with one club. It doesn't really work. So you can't just pick one of the 6 and say, yep, that's my style. That's what I'm going to be. That's how I always am. It's just easy. Everybody else kind of deal with me. So, kind of think about that. If you were to go golfing and all you had was, the driver, that's going to help you hit some really long balls, right? But it's not going to putt very well. God forbid you end up in the sand. You're going to be hitting that several times to try to get out. The different ways different clubs are designed have different effect on the ball. The way different styles exist, they have different effect on the people and on the result that you're trying to accomplish. All right, so moving on to the first of the styles. We'll go through all of them. All right, so visionary. Visionary is clarity on a shared vision. It allows freedom on how best to get there. Okay, so the visionary style is, you kind of set the stage. How is it that you want things to work? And you're clear about that. And you're kind of hoping that everybody sees the world the way you see it after you've clearly identified it, and that they keep it top of mind and they go for it. So, we need to know what direction the ship is sailing. And the only person that really gets to make that 100% call is in our situation is the dentist, right? How is it that you want to see the day go, right? So definitely, in our PPE, part of that is in our practices of at PDS Health, the daily huddle is going to be one of the ways where every day you can kind of set the vision for the day. But it's more than just on a day. It's, do you always want to see something happen in a certain way? You have to be really clear about that. You can't be vague about it. You can't just, try to demonstrate it and hope that they catch on. You have to be really clear. All right, so the next type is coaching. All right, so connects an individual's dreams with organizational goals and it builds long-term capabilities. So if you like to kind of teach your um, your dental assistant and your healthcare coordinator, how that you want things to run, and and you sit back and you give them feedback and you help them and you maybe do practice sessions with them, what you're doing in that situation is you're coaching. Um, Coaching is generally considered positive. And then there's another one next is affiliative. So affiliative, it develops relationships between people, so it fosters harmony and collaboration, and that's kind of where the kumbaya, like we're just a tight group of people. We look out for each other. I'm going to have your back. You're going to have my back. I'm going to respect you. You're going to respect me. We're going to work together, and we're going to all pull our own share of the weight, and nobody's going to be left behind. So that's why harmony and collaboration are so important in the affiliative mindset. So as we're going through this, remember we've gone through visionary and coaching and affiliative. Now we're halfway through. Start thinking, is there one of these three of the six, or one of these six, that you find yourself kind of leaning towards conceptually? And is there one of those that you find yourself kind of defaulting to just in moments of stress or distress? And how does that affect things in your office? All right, so there's another style, and it's called the democratic. Um, sorry, there it is, democratic, and it involves people, and you want to get buy-in, and you want to leverage expertise. So we're greater than the sum of our parts, right? So when you get two people together, there's this third mind that gets developed. That third mind is if you say something and it triggers something in my brain that says, hey, what about this? It's like this whole new idea gets developed that wouldn't have happened had that individual been alone, or had I been alone. We wouldn't have had that idea. But when we're together, this third mind happens to develop, and that, and then once that comes out, then you look for consensus. So is that your style? Is that something that you want? You want to try to get everybody to agree on a course. And, democratic doesn't necessarily have to be unanimous, or it doesn't have to be majority rules even. But just by the fact that you're seeking input and you're trying to get more and more information, and you're trying to meet people where they are, and hear their concerns. I think that typically is what we would be democratic. So those are the four so far, again, visionary, coaching, affiliative, and democratic, that have a very positive effect on the overall mood of the organization, or the small, tiny team. So there's two others. One is called pace setting. Okay, so this is, they typically uphold very high standards, and they achieve tough goals, and they do it quickly, and they're energized by that, and they're working hard. And, that is for sure at times necessary. You all of a sudden an emergency comes in and you're in the middle of something else, but you want to take good care of that patient. So you just kind of have to step up and say, okay, I need you to do this and this and this. And, can you do this and all that kind of stuff? And we're going to just do a really good job. But at the end of the day, this can be, if this is your only or your primary leadership style, it can be exhausting for the team. However, there are people that really thrive in that environment, and they can do fantastic as well. There's one final one that is considered, to be or is called commanding. Okay, and you expect instant compliance. No need to explain. Buy-in is not, the concern of the commander. So this is kind of the historical top-down military type of school type leadership style where I'm in charge, you do what I say, and I don't need you to spend much time thinking about it. I just need you to execute. Go do this. Go do this. Obviously, in dentistry, when we're doing stuff, there are times where we have to be commanding. It's like, hold the cheek out of the way. Can you move the tongue? All that kind of stuff. Those are commands, and that is commanding when you're doing that. But running your entire day in a commanding fashion can be draining on the group. So, um, what happens when you think about this is like I said, nobody uses only just one, right? Everybody kind of has a default. It's your job to kind of identify yourself. If you're not sure, go ask your team. They'll tell you what you are, probably. And they will, they'll if you open it up and kind of listen to them, they'll tell you the pros and the cons of that. There is this concept that all organizations are perfectly designed to get the results that they are now getting, right? So if we want a different result, we must change the way we do things. So you have to kind of look at yourself in the mirror and say, am I getting everything that I want? Is turnover a problem? Are people not engaged? Do I not feel like I'm getting respect? And what I can tell you is you get what you deserve. So, and that's a harsh pill to swallow sometimes, but the sooner that you come up with that realization, the better it is. And that's kind of, I would say, a universal truth. It doesn't have anything to do with dentistry. I think that's just life in general. So when you mix up all these, 6 different types of styles, and you have an organization. So let's think about, you do something and it has a ripple effect. So then all of a sudden, many people are doing different things, and those ripples start to interact with each other. And all of a sudden, you can think of like the water is like it's raining, right? Like it's really chaotic. We call that a climate. All right. Okay, so we have this climate. There's a survey of a bunch of questions where we can, think of how your team, how they would answer each of these questions, and would they all answer them the same? So, I'm just going to go through those questions really quick. How satisfied are you with your company as a workplace? I know what is expected of me at work. Is the vision clear? I have the materials and equipment I need to do my work, to do it right. At work, I have the opportunity to do what I do best every day. Are they well utilized? Are they in the right seat on that bus? At work, I'm sorry. In the last 7 days, I've received recognition or praise for doing good work. Um, my supervisor or someone at work seems to care about me as a person. There is someone at work who encourages my development. So the coaching there, right? At work, my opinion seems to count. So the democratic part comes into place here. The mission or purpose of my company makes me feel good about my job and that my job is important. My associates or fellow employees are committed to doing good quality work. I have a best friend at work. So they feel affiliative, right? There's something going on there. In the last 6 months, someone at work has talked to me about my progress. Are they doing good? That's more of the coaching part. The last year, I have had opportunities at work to learn and to grow. So those are the first 12 questions. There's 4 more. All right, so moving on to those 4 more. At work, I'm treated with respect. So that's the not being commanding. My organization cares about my overall well-being. That's the not being pace setting. We're not running people ragged, but we're giving them the right amount of work so that they feel really energized. I have received meaningful feedback in the last week. So not only are they getting feedback, so you know, are they being coached, but is it happening all the time, at least every week? And then my organization delivers on the promises we make to customers. So, obviously, there's a lot of information. I hope this is really helpful for you. We're going to get together and we're going to go over all of this, and we're going to ask you to identify what you think you're really good at. What's your primary style? Where do you like to be the most, and where do you actually think you are the most? So, I have a tendency to be pace setting. I know that about myself, and sometimes I'm too commanding too. Um, those are weaknesses of mine. However, there are clubs in my bag that I can use when I need to use them. I try hard to use those other four bags as much as possible. So, anyway, I'm really looking forward to our time together. Be thinking about all this. I hope this is helpful when it comes to thinking of yourself as a leader. I know a lot of dentists don't want to be leaders, but we all are because we're in charge. We are the ones with the license. So we have to lead our patients through this healthcare maze, dental care maze. All right. Thank you.